Now we'll quickly try to look at a surgical, that's non-surgical approach to urodynamic stress incontinence. So we're actually looking at the surgical approach, which was more of like you're actually trying to do all those how will I put it? You're trying to do all those sling surgery, sling procedures, and all of that, you know. So for the non-surgical approach, sorry, I'm trying to see something. So non-surgical approach is like things you can do to handle urodynamic urinary incontinence without, you know, surgical invasion, you know. So let's look at it. So non-surgical, it just include things like pelvic floor training. So there are different trainings to actually strengthen your pelvic floor. So things like Kegel exercises, all right, recommended as the first line of treatment, okay, often guided by physiotherapists or enhanced with biofeedback. Then we have the behavioral modifications, things like bladder trainings. So you can just schedule your voiding, okay. So outside the schedule you won't void, okay, just train your bladder again, you know. Then behavioral modification, okay, so spoken about bladder training. Lifestyle changes, like you try to lose your weight, okay, that's when you talk about the obesity things. And so you have to lose your weight, reduce taking caffeine and alcohol, manage your constipation. Fluid management is you avoid excessive intake of fluid and all of that, okay. So moving, then pharmacological therapy, that's where you involve things like duloxetine, okay. So it's a serotonin norepinephrine uptake inhibitor, enhances urethral sphincter tone, is used in some countries for stress incontinence, though it's not universal. Then women, basically you can also be using topical estrogen just to improve urethral mucosa integrity and vascularization. The mechanical devices, you can use continence pessaries, vaginal devices that support the bladder neck, okay, urethral insert, vaginal cones. The adjunctive therapies, all those biofeedbacks, okay, helps patients to identify and train correct pelvic muscles. Electrical stimulation stimulates the pelvic nerves and muscles to improve the tone. Electroacupuncture, okay, supports, okay, basically, all right. So this is if you are not doing surgery for urinary incontinence, this is how you basically go for non-surgical measures.